Benzodiazepine. So we're gonna go over today the benzodiazepine, one of the most widely used medications in the hospital settings. First of all, let's take a look at the mechanism of action of benzodiazepines. So we have a GABA, which is also called, the full name is gamma aminobutyric acid, which is a neurotransmitter transmitter in our brain, in the brain. So the GABA neurotransmitter is actually an inhibitory neurotransmitter in the brain. So when your brain secretes this GABA neurotransmitter, it causes the sedation. It helps you relax. It relaxes your muscles, and it and also the anticonvulsant effects. What it means. So in your brain, when the neurons are firing like constantly, when this neurotransmitter releases, those firing rates of neurons will significantly decrease. So it causes the decrease in electrical activity in brain as well. That's why it causes the anticonvulsant effect as well. So basically, this benzodiazepine drugs, what it does when you give this benzodiazepine drug, it increases the effect and secretion of GABA in the brain. So when you give this benzodiazepine medication, it increases the secretion of this GABA neurotransmitter in brain, and it potentiates the effect of GABA in our brain, and will causes more sedation, relaxation, and decrease in neuron firing rate, which is anticonvulsant effect in our brain. So that's how basically the benzodiazepine works. There are many use of this benzodiazepine. First of all, if we take a look at it, it is used as an anti-anxiety medication. So if a patient has a generalized anxiety disorder or panic disorder, we can give this medication to help them calm and reduce their panic attacks as well. This medication is also used most often in critical care and in hospital for sedation and for relaxation as well. This medication is also used for insomnia and sleep disorders, since it causes the sedation and dizziness. It will help you feel relaxed and will help you to sleep better. However, this medication has to be prescribed by the doctor's physician. This is not the over-the-counter medication, because it has a very many side effects, and also this can actually make you dependent on this drug really badly. So that's why this is a kind of controlled substance as well. This medication, as we talked, that this medication will decrease the neuron firing rate in our brain. So that's why these medications can be used for seizures as well. And one of the two medications we'll talk about later in this video that usually used for seizures in emergency. This medication is also used for the alcohol withdrawal symptom. So whenever some persons comes to the hospital and they are alcoholic, they drink a lot of alcohol at home. Now suddenly they're not gonna drink, or they won't be getting any alcohol in hospital. So they will go into the alcohol withdrawal symptoms like agitation, tachycardia, and hypertension. They'll be anxious all the time. So these are the symptoms of alcohol withdrawals. These medications are widely used to control these alcohol withdrawal symptoms for a patient who has a long history of alcoholism and so forth. All right, those are the indication. What are the side effects? All right, many side effects. First of all, the CNS depression, central nervous system depression. It can cause sedation, ataxia, decreasing cognitive function and so forth. Like it decreases the CNS system. So whenever you have a patient on this medication, you want to really teach them, like when you take this medication, avoid driving for sure. Do not operate heavy machinery, or do not do any kind of activity that in which you have to use your mind significantly, because this one actually significantly decrease their ability to perform any kind of work that requires high cognitive functions. And it also causes ataxia. So if they need to do some small works, like it needs to be really careful, like a driving that requires really good skills, they can't really focus and do it very well. Now this medication, if you give this medication in a high doses, it can cause the amnesia. Means it can impair their memory for a short period of time. So it can cause anterograde amnesia. This medication can cause the respiratory depression, so you have to be really careful when you give this medication to a patient. However, these medications are kind of like safe as far as we talk about the respiratory depression. You may have seen patient getting barbiturates, which is often used for seizures, anti-anxiety, and like those kind of stuff. But these medications are kind of safe compared to barbiturates in respiratory depression. You have to give this medication in really, really high dose in order to cause a respiratory depression compared to barbiturates. But it still can cause the respiratory depression. This medication can cause the significant hypotension, cardiac or respiratory arrest. Now, sometime if the patient is on this medication and they suddenly stops, like if they're taking this medication for 6 months, 12 months, and then they suddenly stops, this can cause the paradoxical response. So it can cause the opposite. So it can cause the very bad insomnia, excitation, euphoria, and anxiety. So you don't really want to suddenly stop these medications as well. And you want to teach patient about that too. Like, do not suddenly stop this medication, because it can cause the paradoxical response, and then they won't be able to sleep. They'll be anxious all the time, hyperactive, and so forth. And sometimes this medication can cause the withdrawal symptom as well: paranoia, panic attacks, muscle twitching, and hallucination. So those are the bad side effects of these medications. Now, what are the contraindications for this medication? As we talked in the previous slide, that this can cause a significant respiratory depression, cardiac depression. This one has a significant sedation effect as well. So you don't really want to give this medication who patient has a sleep apnea, a respiratory depression, obviously the liver disease, because this medication is metabolized by liver. So it metabolized by liver and goes into the inactive form. Now, if someone has a liver disease, this medication won't be metabolized by liver and will not be converted into the inactive form. Then what will happen? This medication will build up into up to the toxic level in the body, and can cause really bad side effects like respiratory depression. They'll stop breathing, cardiac arrest, and like those really serious side effects. And you want to be really teaching your patient as well, like, do not take this medication and then drink, because if you take this medication with alcohol, they can cause like really, really bad respiratory depression and sedation, and could be really lethal. Barbiturates, opioids, and any other sedative medication like Benadryl, let's say for example, which is also used for allergic reaction. However, they can cause a really significant sedation, and many people uses Benadryl over the counter medication so they can sleep better. However, if they're on this medication, benzodiazepine, you want to tell them that do not use any over the counter medication without talking to your physician, because some medication can cause really bad sedation and respiratory depression as well. So you want to be actually teaching your patient about that too. Now, what is the antidote of these medications? If you have a patient and somehow the patient got high dose of this medication and had really bad respiratory depression, what would you do? Or cardiac arrest or cardiac depression, like that. The antidote is flumazenil. So this is the antidote of this medication, this group of medication, benzodiazepine. It will reverse the respiratory depression. So you want to be really careful, because these medications are widely used in hospitals. Now, what are the examples of this medication? All the Z-PAM, usually, like, see, if you see that, diazepam, lorazepam, temazepam, oxazepam, clonazepam, furazepam. This is the only different medication, the name chlordiazepoxide, and that's a really actually old benzodiazepine medication. It's been in the market for a while, but these are the medication, like, easy to remember. Anything ends with the Z-PAM is benzodiazepine. And usually this lorazepam and the diazepam are widely used medication. They are used for seizures, often in the critical care, especially if you are working on neuro ICU. You'll see this medication a lot to control the seizures. Then you will use this as an anti-anxiety medication. This one also for panic disorders. So these two medication are widely actually used for in a wide variety of settings, like critical care, and also some patient goes on this medication at home. So you want to be really teaching about that we went into the previous slides. All right, that was it about the benzodiazepine. If you have any questions, just let us know or email us. Thanks for watching.